And it never made sense to me that, we have support for hip replacement and knee replacement and any other body part we need to replace. Why don't we have that same type of support for something that's so important as our dental health, replacing gateway to our health? I've always felt like our mouth is, it's mind, body, spirit. It's the way you nourish your body. If you can't chew your food, you can't nourish your body. If you're not, you don't have good teeth, you're not smiling, you're not interacting with people. All of us just want to help more patients, right? $60,000, $30,000 for full mouth reconstruction. That's a lot of money. And if we can help more people be able to afford this treatment, how great is that? I want more offices to understand that it's possible. I want them to have higher revenue. I want them to have higher case of acceptance. I want these doctors to be able to help these patients, more patients, be able to afford it. I want to come alongside these patients. I want to empower them. I want to advocate for them.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, an Endeavor Business Media production. This is episode number 382. I'm your host, Andrew Johnston, and thank you so much for making us a part of your day. We have a great episode for you today, but lots to get through before we get there. We are going to be talking about medical billing and dentistry today with Danielle Brown. She's our guest, and this was recorded back in Chicago at the Midwinter meeting, so it's been several months since this was recorded, but I think it's a super fascinating topic. And I really look forward to bringing Danielle back to dive a bit deeper into the possibilities of this a little bit later on again. But this one is essentially just an intro to the concept. I think, for a lot of us, it's really hard to discuss huge treatment plans with our patients. We want to be clinicians first and not really talk about the money. But I think, knowing that dental insurance, if you can even call it that, how limited it is, we don't feel super comfortable about it. But I think when we know that there are people out here like Danielle and that there's another way to utilize the tools that a lot of patients do have, then we should be looking into it and maybe making suggestions to our patients. So hopefully this will at least plant a seed in your minds, get you thinking about those possibilities for them. And then next week, we have another great episode. I'm not exactly sure, honestly, what the episode is going to be. We have a lot of things that we have planned. Nothing is recorded as of the moment that I'm doing this intro. But we have planned episodes on nicotine addiction. There's an episode on sex, drugs, and oral cancer. There's an episode with Dr. Kim Cooch that I'm really excited about. There's another episode that I'm also really excited about with Dr. Ben Holbert. If that last name sounds familiar, Holbert, that's because he's brother of everyone on the podcast best friend, Daniel Holbert, who's I don't know, he's not a semi-regular, but he's been on the podcast a ton of times. And so apparently his brother is a dentist. And so I want to talk to him a little bit about, what's it like being a young doctor now? What's it like being an associate? What's it like being, a doctor in a rural community? Just all of the different things that we have that maybe not mainstream dentistry talks about. So be sure to join us next week for this surprise guest of whoever we're going to end up having on. But I mean, if that doesn't tell you though, what's coming up, I mean, the rest of the month is super exciting. So I have several other things that I want to kind of update you on because I feel like it's been a bit since I've done some, it's not housekeeping, but I guess just some personal things. And the first thing I want to talk about is the pup. I've actually had several of you ask me like, hey, so you said you were going to give us all these pictures and updates and stuff on the dogs. And I really haven't. And part of it's because I'm just not on social media very much. But our dog, Otis Mango Pudding, he is the most amazing. He's a blackmouth cur that we got back in November, and he's doing great. He's doing super, super fantastic. Pretty much the bestest little boy that ever existed. He's incredibly smart. He's very obedient for the most part, knowing that he's still technically a puppy. So you can't he's not perfect. But he's also only the second dog I've ever raised from being a pup. And every other dog I've always had kind of already had their personality already entrenched, right? And so they came from like either a rescue or we got them from a friend of a friend or whatever. But, I've just been really, really excited with him, but also a little bit like hesitant because I just didn't know what to expect because the dog before, I think I've told you guys all about Bronco Bear. Bronco was a German Shepherd and he was just seriously the best dog I've ever had in my entire life. He was the one that could really I think honestly, and Otis is showing a lot of these same signs, but I feel like they understand all of my words. Like they speak English, or they can comprehend English. They can't speak it back, but even like the little micro expressions that I might have, which if you've met me in person, I have a ton of facial expressions, and some of them are overt and some of them are kind of little micro expressions, but they both picked up on them really quick. They know what we want them to do. They are, I think they're as close to a human as a puppy can be. As far as the kids go, as far as the wife goes, like he and Molly will snuggle multiple times every day. He is super lovey and snuggly. I think if you know the breed, blackmouth curs generally are pretty known for just like plopping down on top of other dogs. And so like I just don't want to they just I don't know. I don't know if it's just like they like the contact with someone or something else, but I would see in the blackmouth cur Facebook groups that maybe like they'll have a husky or a lab and then they'll show their cur on top of the other dog, just kind of just snuggling with each other. So, both Otis and Hudson, in my opinion, they probably just see Molly as like another puppy. And so they're all just like laying, all around hugging each other. And then the update for Hudson was the brother dog that we took. We did take him over to my parents' house in February. I think I might have mentioned that already. At first, I think Otis was pretty bummed about that. But, Hiram, my son, kind of picked up the slack of that wrestling kind of play toy, which I know both of them really love it a lot. He does this thing, and you've probably seen this with dogs and puppies or whatever, where, they go and they're playing around and they go to bite. But when he like actually makes contact with Hiram, he never actually bites down. He just kind of like puts his teeth on Hiram, and he's good. He knows the limitations. But then Hiram taught him this really cool thing where, once playtime is over, he does a command, and that like kind of like almost like hypnotizes, like boom, takes him out of that rhythm. And Otis is good. He just goes back and he calms down. And then we have Zach, who is almost 17 and pretty much too cool to show emotion for anything. And he just gets really sappy, and he does all the snuggles as well. He actually even made up his own nickname for the dog and everything. Everyone loves him. Allison, who I don't know, her and I have talked over the years about like what we would do to get like another dog or not get another dog. And, while the kids are here, we like having dogs in the house, but once they're gone, do we want to travel to all the other things? And, she wasn't against getting a pup, but I think that she really wanted to make sure that she wasn't going to be the only one responsible for him. And I will tell you what, like she has taken such a shining to him. I usually get up before she does. And so I'll go downstairs and I'll feed him. I'll let him outside and do all the things. And then when she comes down the stairs, he is like the very first thing that she goes over to say good morning to. Like, it's so, so incredibly cute. But anyways, the pup is amazing. So glad that we got him. If you are looking at rescuing a dog or whatever, I highly suggest this breed, blackmouth cur. They're just the best. Now, if you're a regular listener to the show, you'll know that Mondays we have our Fast Facts Perio edition, and that's with Katrina Sanders. And this month we decided to kind of change that up just a little bit. And so the format for Fast Facts has always been, kind of 3 to 5 minutes, really fast. And truly, like this change, I could really use some feedback on it. What we decided to try and do, Katrina and I actually had a call about it. And, she has such a great personality, and I just felt like we were kind of limiting her a little bit and not really getting her to express herself in probably the most truthful way. And so, we talked about it's going to be just a touch longer of episodes coming up, possibly maybe even bringing a guest on occasionally, maybe once a month or something like that. And really giving you more than just like the quick, hard hitting research that she normally does. Personally, I love the last 2 episodes that have come out because I think it just puts into perspective ways that we can use the information that she gives us with the patients. Specifically, when she was talking about having a note on the office letterhead to give to the patient's doctors and asking them to collaborate with her directly. I think that was a great idea. I think it's really hard to get some of these medical professionals to collaborate with us, but if you have it on the letterhead, I mean, that's so smart. And so not only she tell us about, kind of the correlations between diseases, but this is also like the next step you can take. And that's just amazing. So give them a listen this month. Let me know what you think. You can send me an email, andrew@atale2hygienist.com. And I really like it, but if this is something that you guys don't want, remember this podcast is all about, what you all want. So if it's not something for you, then let me know that too. RDH Under One Roof is just 2 months and 10 days from the day that this releases. We will have a podcast lounge set up in the middle of the exhibit hall floor. So make sure you come over and say hello. We are going to try and have something fun to do also there so we can kind of just hang out, but it'll be mostly during exhibit hall hours because I think that's when most people are available. So come over and say hi, get some pictures, do all the things. And then kind of along those lines, we usually record a ton of episodes at RDH Under One Roof. I'm going to shoot for even more than last year, which I think we did 15 or so last year. But if you have guests or topics or people that will be at RDH Under One Roof, even this is going to be like a roundtable type situation. You want to be a part of a roundtable. You could suggest the idea and be a part of this. Let me know because I'm building out the schedule of when we're going to be doing the recordings. I already have probably about 10 recordings scheduled. So, we'll work around that. But I'm always just curious about what people want to talk about and what they're thinking. So make sure you send me that email, andrew@atale2hygienist.com, and just make those suggestions. Okay, I think that is all I have for this week. Thank you so much for listening every single week. Please make sure you tell your friends, make sure you subscribe, and enjoy this episode with Danielle Brown.
A tale of two hygienists.
All right, so let's get started. Welcome to our podcast. So excited to have you here. This was kind of a random way of finding each other a little bit on via Facebook Messenger a little bit. But welcome, Danielle. I appreciate you being it.
Thank you so much for having me, Andrew.
So because I also don't know you all that well, do you mind just kind of explaining to myself and the listeners just like your background and where you're coming from?
Yeah, my name's Danielle Brown. I am a patient advocate that helps dental patients maximize their benefits by utilizing medical and dental benefits so that they can better afford their treatment.
I love that. I love when we're talking about who we're going to have on the show this weekend. This is going to be the one that I'm really excited about talking about. Things for patients, helping them through a process that can be so difficult and so anxiety ridden, and it takes time, and people just don't want to have to be burdened by that.
Yeah.
So what got you super driven about this?
Well, I've been in dentistry my entire adult career, more than 20 years. I love it. There's always been something magical about helping someone transform their life by transforming their smile. Mm-hmm. And now we know that there's so much more even connected through our overall health is connected to our dental health, and our entire systemic health is so important. So I've always been really passionate about it. I've been everything from a dental assistant to an office manager to a software trainer with Patterson. And my last several years have been a treatment coordinator, patient education consultant, treatment coordinator. So the dentist gets the fun job of actually doing the transformation. And I'm typically the one that gets to sit in the office with the patient and say, well, through doctor's findings and recommendations from her exam, the teeth are unrestorable. Mm-hmm. We're going to have to remove them. And we can either give you dentures that'll give you maybe 20% of your chewing capacity back and continue to lose bone and function, or we can go with dental implants that are going to give you 90% of your chewing capacity back. That's going to support that bone, give you a long-term solution to help you be healthy throughout the rest of your life, and that'll be $60,000.
Yeah.
So that's a very difficult conversation. And it never made sense to me that, we have support for hip replacement and knee replacement and any other body part we need to replace. Mm-hmm. Why don't we have that same type of support for something that's so important as our dental health, replacing, the gateway to our health? I've always felt like our mouth is, it's mind, body, spirit. It's, it's the way you nourish your body. If you can't chew your food, you can't nourish your body. If you don't have good teeth, you're not smiling, you're not interacting with people. So, this is such an important conversation to have. And in doing research, well, guess what? There are opportunities for medically necessary dental treatment to be covered by our medical insurance. Not everyone has those benefits, but isn't it worth fighting for? Isn't it worth researching? Isn't it worth finding out? And it's difficult for a dental practice. There are few dental practices that have really embraced billing medical. Mm-hmm. We're not taught those codes. We don't even have the software to submit it. Right. We don't know that language. So that's part of my mission, and my goal is to open up this conversation to help empower patients So if you're out of network and a doctor's office doesn't submit medical for you, as a patient, you can request to have reimbursement back for these out-of-pocket expenses. So what I found is that the patients have so much more resources as they're advocating for themselves.
I think I'm jumping way to the very, very end of this, but and we'll come back.
That's okay.
Big picture is the fact that we have dental insurance and health insurance a problem, or should it be like your health insurance is inclusive of dental needs? I mean, should that be the way it goes?
Well, yeah, our medical insurance covers us head to toe. So if it is, we have to learn to speak the language.
Mm-hmm.
So if we can show that these dental procedures are medically necessary, it's treating a systemic issue, a systemic problem, then that's considered medical necessary. And
even for something like a scaling and root planing? Or is it like surgical procedures generally?
More surgical procedures. I mean, there are some people that say there's a code for everything.
Sure.
So
you just gotta find it, right?
Right? But for example, a friend of mine, her daughter has lupus. All of her dental is covered under their medical.
Really?
Yes.
Now, is there like a clause that says like, okay, you have to try and submit to dental first, and then whatever they don't pick up, kind of like how if you have like a partnership, like the husband has a primary insurance, the wife will have a secondary insurance. You have to, for the wife's things, you have to always try and build her insurance first, and then they'll pick up on secondary. Is it something like that or not even?
Well, yeah, it is considered primary and secondary, but if there's an underlying health condition, medical would actually be the primary.
Okay.
There are cases now that the dental insurance is actually sending it back saying this needs to go to your medical first.
Really?
Yeah.
I love that.
Yeah.
So do you feel like the dental insurances are the carriers and the representatives that are working with the patients, do you feel like they understand the medical side too? Or is this still like a Wild West unknown for carriers like that?
That's a good question. I think that the conversation is beginning. Every year we see more medical codes in our ADA code book, our CDT code book.
Yeah.
So I think that conversation is starting. I think that there's just more need for more coverage. So, your dental insurance, you might have $1,500 as an annual maximum. It is a supplement to your medical insurance. So, if we're talking about, diabetes with periodontal disease, that's considered medical necessary.
Right.
Yeah. And, so many other, autoimmune disorders, any kind of cancer treatments. Now if a patient needs to be cleared for surgery, their dental work can be covered under medical insurance. Now, I have to say, too, that, we're not talking about Medicaid, Medicare yet at this point. But, Blue Cross and Blue Shield, your Aetnas, there's a lot of insurance companies that we work with that are starting to now see more of the dental claims and not just pushing it back to the dental side. Oh, you're a dental provider.
So do you work with one particular practice, or do you go into multiple practices and do this for patients?
Multiple practices. Yeah, so I'm really coming alongside of patients. So the dental practice would say, "Hey, we don't submit medical insurance, but maybe here's someone who can help you."
I see. Okay.
So I'm acting as that advocate until we really get this conversation started. I think the dental practices need to see that it is possible, because it's such a huge undertaking for a dental practice to have someone trained in medical billing, purchase the software, have someone full time with accounts receivable. And the aging of those claims, it's we all know insurance is difficult.
But it should be worth it in the long run if they can kind of endure that, though, right? I mean, because the payouts can be decent.
And I know, all of us just want to help more patients, right? $60,000, $30,000 for a full mouth reconstruction.
Yeah,
that's a lot of money. That's and if we can help more people be able to afford this treatment. How great is that?
So walk us through maybe okay, so you're affiliated with all these dentists or these practices, and they refer the patient to you. So the patient would have to reach out to you then at that point. They don't say, hey, we have a patient, can you contact them, right?
That's correct.
Sub HIPAA or whatever, right?
Exactly. Yeah, the patient would need to contact me, and my website is completely,
and
I
then
have
what
a portal
does that look like?
HIPAA secure. So the patient would go to the website, put their information in. There's a secure portal, so everything's encrypted, everything's protected. And, I always have a conversation with them because the patient pays me to be their advocate.
Sure.
So, I work with the patient, we're going to work as a team together, and I help them go to, most people don't even know that they have a portal with their medical insurance. And there's so many resources there that's just fantastic for the patient. So I talk to them about, is this medically necessary? Talk to me about your history. They sign the waivers that say that I can speak on their behalf. I can reach out to their primary care physician, their dental provider, help them collect all the information that we need.
So this is all your documentation, all of your radiographs, all of your scans, lab work, whatever, right? Okay.
And everything that we need to show medical necessity, support the claim, kind of help build that claim, build that case. Again, it's speaking their language. It's telling the story of the why behind.
Yeah.
What is the purpose? What is it going to solve? So just walking that patient through that process of submitting it to their insurance, and then we help them follow up with that. They're almost always denied the first time.
Of course, insurance company. We don't want to pay out. That's right. Denied.
And they, they're not anticipating the patient to necessarily come back with the
more
documentation and more information.
Yeah.
And, but I got a lot of fight in me. So.
What would you say is your biggest submission? What is it? Is it implants, sleep? What is it that you're encountering the most?
The biggest payouts are the dental implants, the full mouth reconstruction with dental implants. You can, for $30,000, lower arch reconstruction, like $20,000 in reimbursement.
Great.
How great is that for a patient?
Wonderful.
Yeah.
Does generally the patient reach out to you before they've started the work?
That's best.
Okay.
Yeah. If I can get them before they've started the treatment, then we can get pre-authorization. We know exactly what it is they're looking for. We can gather all that documentation beforehand.
You pre-assess to make sure that you're covered, right? Like I think that's a huge thing. I don't want to be $30,000 and they're like, oh, by the way, this isn't going to be covered.
Right.
And now I'm out of pocket, for that.
But that happens in medical too.
Yeah.
There's never a guarantee, but it gives us a better chance of getting reimbursement if I can get them on the front end and kind of walk them through what we need.
So I'm going to show more of my ignorance here with insurances and all life. So usually, from what I understand, like with medical coverage, there are yearly maximums for like yourself or the family or things like that. Does that apply also here?
No,
Okay.
That's what's so beautiful about it. Yeah, dental insurance, they say you maybe have $1,500 as an annual maximum. You can only get 2 exams a year, completely different in medical. Maybe $1 million is their maximum.
Yeah, okay.
They really don't have those maximums if, you're being treated, for a medical condition. You can have as many exams as you need.
Nice.
Yeah,
That's really good.
Yeah, the 3D, CAT scans are covered, the exams are covered.
I could just see some like medical insurance like, I'm sorry, we have a maximum now because it's dental. I'm just getting all snotty about it. It's like, all right, that's enough of that.
I believe that medical insurance does want, if they understand how important dental health is to overall health. Once we really start this conversation and they start seeing how important this is, they're going to want to pay for you to get your teeth done. Come on, that's going to save them a lot of money down the road. How many times do we see, in patients with diabetes and their numbers are all over the place and crazy and their periodontal disease is out of control? Once they get that periodontal disease under control, their numbers are starting to stabilize. It's like, we see that all the time and so many other cases like that.
Are there, I don't say like obvious exclusions, but are there cases where you're just like, okay, this isn't going to work at all, like 100% is not going to work, don't even bother?
Yeah, that's why I talk to the patients before, we start any type of process. There are times that I know that this insurance isn't going to cover it or this procedure isn't going to be covered, so I always like to have a one-on-one conversation. Plus, they know that they're talking. It is such a scary time for a patient to, walk into the dentist's office and then be told that, your teeth are failing, it's affecting your overall health, and this is what it's going to take to make that better. I just like to be there as a support for them for that purpose too, because it's scary and you don't know who to trust. And
That's the truth.
Yeah, I'm going to spend all this money, and is it going to work out okay? And if I can just be another voice of reason, just someone to talk to a little bit, give them some hope that maybe we can get some reimbursement back. How great is that? I just try to be there to support them along the way. It's something I'm passionate about. My mom actually had a situation where, thousands of dollars in root canals and crowns and bridges. And, she went through all that, had some medical issues. And of course, over time, that stuff just all breaks down. And, before I was in the role, this was many years ago. So before I was in this role, let's look into implants. What will that take? And, to just understand how incredibly costly it is. I mean, that's, I think, what really fueled my passion to start doing some research and figuring this out.
Oh my gosh, I love that. How do you manage to keep all the different insurance carrier information? Do you have software that helps you sift through that? Do you have a team that works with you? Like, how do you do all that?
Yeah. So I have a software system that helps me manage all that, and I have a business partner.
Yay.
Yay.
We're growing. But this is just something that's so important that I just want more offices to understand that it's possible. I want them to have higher revenue. I want them to have higher case acceptance. I want these doctors to be able to help these patients, more patients, be able to afford it. And I want to come alongside these patients. I want to empower them. I want to advocate for them.
Do you feel like an office could have a you type person in there? I mean, a lot of like the bigger, like the oral surgeon's office, they have a lot of treatment plan coordinators and stuff like that, especially for that kind of stuff. But I don't recall, like, my little sample size of getting my wisdom teeth out at an oral surgeon's office or whatever, but I don't recall there being like medically trained insurance coordinators. Is that common in oral surgery?
It's not common.
Okay.
I think probably more oral surgery offices have someone in that role. Yeah. But it's not a given that they're trained on medical billing, and there are some great consulting groups out there that can come in and train the office, and they've got the software they can do the back end support on that as far as submitting claims and following up on claims.
Is that not something you want to do? Is consult on that?
Yeah, I mean, I can do that too. I enjoy that, but right now my passion is really supporting patients, and I think right now it's about starting the conversation. It's about I have had a couple of offices call me and say, "Hey, I read your article in ADOM, American Association of Dental Office Managers. Can you help us with this case or this case?" I've done some individual cases with them, but
does it matter where they're like regionally located?
No.
For you to do that? Oh, okay, that's nice.
Yeah, all over.
So do you find that the medical insurance deductible that the dental applies towards it?
Yeah.
Oh, that's great.
Yeah, there are times that, so sometimes everything that we recoup is, a big chunk of that goes to their deductible. But hey, it's still helping them in the process of
sure
maximizing their benefits.
Right. Absolutely. And then if someone's listening to this and they say they have a patient that just completed like a huge case, but they didn't know there was someone like you, is it too late?
No. Typically patients have 12 months after their date of service to submit a claim on their own behalf and request reimbursement, and I can help them with that.
I love it.
Great.
So let's get into that contact information. So you have a great website, by the way.
Thank you.
I did a little bit of perusing on that. But where could they find you? Where can they reach out to you?
My website is mysmileinsured.com. Call, text,
Are you on social
email.
media? Or?
Yes, Instagram, Facebook.
Okay. Awesome.
Absolutely. Yeah, it's all my smile. Everyone deserves a healthy smile.
That's right. Any last messages for our listeners?
Advocate for yourself. Let me help you. And what I really want to say is that, patients have so many resources available to them that I don't think that they're aware of. I'd love to help show them a little bit about like what's in your portal and what kind of benefits that you have, and, advocate for yourself.
Yes, I love it. Well, thank you so much for being on.
Thank you so much for having me.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.